Welcome to our channel. If you want to clear adult acne and achieve healthier skin, follow these step-by-step strategies. Step 1. Cleanse your face twice daily with a gentle, non-comedogenic cleanser to remove dirt, oil, and makeup without stripping natural oils. Step 2. Use products containing salicylic acid or benzoyl peroxide to unclog pores and reduce acne-causing bacteria. Step 3. Apply a non-comedogenic moisturizer even if you have oily skin to maintain skin barrier function and prevent overproduction of oil. Step 4. Avoid touching your face throughout the day and never pick or squeeze pimples as this can lead to scarring and infection. Step 5. Change your pillowcases at least twice a week and clean makeup brushes regularly to reduce bacteria exposure. Step 6. Review your diet and consider reducing dairy and high glycemic foods, which may trigger acne in some individuals. Step 7. Manage stress through relaxation techniques, as stress hormones can trigger oil production and inflammation. Step 8. If over-the-counter treatments aren't effective after 3 months, consult a dermatologist for prescription options like retinoids or antibiotics. Don't forget to like this video and subscribe to our channel.